Hello, this is Dr. Heilig giving a presentation on ankle arthroscopy, what to expect with that procedure. I am with the Short Orthopedics of Kentucky. Some common indications for an ankle scope include OCD, which is osteochondral defect. This is a piece of cartilage, typically with some bone that has been knocked off. It's usually post-traumatic in nature. Um, Usually off the talus. The ankle has the tibia or shin bone, which rides on the talus, which is one of the bones in the foot. Sometimes it's off the tibial side. Chondromalacia is just damage to the cartilage only. Typically has kind of a scuffed or frayed appearance. Arthritis, you can go in, clean the joint out. If there is just exposed bone, you can do a microfracture where you just make small holes through that bone, which allows bone marrow and stem cells to come in and create new cartilage. Loose body, there may be something floating around in the joint that's getting hung between the bones and causing pain. This can be a piece of cartilage or something like that. Scar tissue, this is usually post-traumatic as well. You can get scar tissue that's in the joint between the bones and causing pain and or stiffness. Synovitis, that's inflammation of the lining of the ankle, which can cause pain. You can go in and trim that out. Things to know before surgery is nothing to eat or drink for about 8 hours before surgery to prevent or help prevent any complications with anesthesia. Um, you should plan on not using, it's a typo, it says knee, should be ankle for about 6 weeks. Typically you can use it, but it'll be limited. It'll be kind of stiff and sore, and kind of babying it for about 6 weeks gives you a better result. Good nutrition, you want to have the best diet possible. That helps with the healing. Avoiding smoking, it's recommended to not smoke for about 6 weeks before surgery and about 3 months after surgery. This will also help with wound healing in foot and ankle. The wound healing can be an issue. It's a more difficult area to heal than other parts of the body, particularly in diabetics. After surgery, you want to follow your surgeon's instructions to the T to get the best possible result. For wound care, I typically recommend to remove the dressing about 2 days after surgery. You can then wash over with soap and water in the shower, but do not recommend to soak it underwater until the stitches are out. I'll have you back in about 2 weeks for those. I do typically give the patient some crutches. May or may not have a brace. I will usually allow weight bearing as tolerated depending on the procedure performed, and I will tell you one way or the other after surgery. Driving, if it is your driving leg, the right leg, probably should not for at least the first couple of weeks, as if you had to, because if you had to hit the brakes in an emergency situation, the pain in the ankle may prevent you from doing that. No lifting, pushing, pulling. Like I mentioned earlier, you want to kind of baby it as much as you can and avoid any heavy stuff during that healing process. Pain control is important after surgery. This is not typically a very painful procedure. A block can be performed. Scheduled anti-inflammatories alternating with acetaminophen help with pain. I typically will give some narcotic pain medication to take as needed for breakthrough pain. Icing is important to help with pain and swelling. Once again, typically we'll give you crutches, possibly a brace, and those do help with pain as well. Physical therapy after an ankle scope isn't as important. Typically, I do not recommend formal physical therapy after an ankle scope unless there's an issue with stiffness, in which case I will. You can start out with passive range of motion and then progress to active range of motion, typically as soon as you can comfortably. You can map out the ABCs with your toes, and that will put the ankle through a full range of motion. You can progress to some strengthening, typically about 4 to 6 weeks after surgery. This concludes the presentation on ankle arthroscopy. Please do not hesitate to contact me at Assured Orthopedics of Kentucky if you have any questions. Thank you.